If you're suffering from any type of hip, glute, or low back pain, and you find yourself sitting a lot during the day, you're going to want to check this video out. So I'm going to be talking specifically about a muscle called the glute medius. Now, the glute medius' main function is to abduct the leg, so bringing it away from midline, as well as balancing the pelvis when we stand on one leg. So how do you know if you are suffering from glute med inhibition or just a lack of the ability to contract the glute medius muscle? So there's a couple tests we can do, and the first one is called Trendelenburg sign. And what you do for this test is you ask the individual to stand on one leg, and then you should see this is a negative test, so I do not have glute med inhibition when I'm performing this. And what we're looking for is a pelvic unleveling. So what a positive test would look like is if you stand on one leg and you see the hip kind of jolt out like that. So this side drops lower than the other side. You may also see the individual kind of lean on one leg in order to kind of offset that balance. So if you cannot perform this test without keeping the pelvis stable, that's a sign that you have glute medius on the side that you're standing on. Another way that we can see this is observing somebody walking. So if someone was walking and they had one-sided Trendelenburg, it would look like this with their hip going out with each step. Some people have bilateral Trendelenburg sign, and what that looks like would be something like this. And you'd see that hip shift each time with each successive step. So the reason why this develops is because, we sit for long periods of time. And when you're in this sitting position, you're not actually using your glute muscles for any type of weight-bearing activity. If you're having this gluteal inhibition, here's some exercise that you can do to build that contraction in order to wake up those glutes and start activating the hips, get yourself out of that hip, glute, or low back pain. So a great way to isolate this muscle is performing clamshells. So what you could do for this is put your hand on the glute medius, and to find that muscle, you're going to find the bumpy part on the side of your hip, and then just move about an inch back or so. And then you're going to squeeze the glute open just like that, and you should feel some contraction. If you want more resistance, you can grab a resistance band and throw it around the knees for that. Another way to isolate this muscle is to perform a hip abduction circuit. Now, what I like to do for this is you lay on one side, and then you're just going to squeeze the glute to lift the leg into abduction. Do about 10 of these repetitions regular. Then I want you to internally rotate at the foot, and then do about 10 repetitions that way. And then externally rotate the foot so the heels are touching, and then about 10 repetitions that way. And repeat for about 3 sets. And that's a great way to strengthen that glute. So now that you've isolated that muscle and you've built a little bit of strength, it's good to test how you perform weight-bearing activities. One of my favorite ways for beginners to perform this is a kneeling hip hike. So what you would do for this exercise is you would stand on one knee, and you would try to lift the opposite leg up and hold for as long as you can, trying to keep balance and keeping the pelvis stable. So work your way up to holding for about 3 to 5 seconds or so, and repeat on both sides for about 10 to 20 reps, about 3 sets. If you have any reason why you can't get on one knee, another way you can perform this exercise is standing. So these would be standing hip hikes. And the way we're going to perform this is you're going to go into kind of that positive Trendelenburg sign where we're not activating the glute, and then you're going to squeeze until the pelvis goes into a stable position. So we're sitting in the positive Trendelenburg, squeezing the glute until our pelvis is upright. What that looks like from behind is let that hip fall out, and then just extend and squeeze until we're straight. Once you build a little bit of stability and you're able to perform those hip hikes pretty comfortably, the next step we want to do is come over to the stairs. And this is one of my favorite exercises to help build that glute stability and strength. So what you're going to do to start this exercise is you're going to be balancing on one foot, and then with the opposite foot, I want you to point the toe up. You're then going to work on lowering that leg until the heel taps on the ground. What I want you to focus on during this exercise is that leg that we're standing on, that weight-bearing leg. Really try to push the knee towards the outside, okay? So try to push the knee as lateral as possible, and this is going to keep that glute activated and keep our knee in a good position over our ankle. And for this exercise, I also want you to focus on going as slow and controlled. The slower, the better. If you want to make this exercise a little bit more difficult, you can grab some weight, and this will make it a little bit more challenging. Hold it with the same arm as the leg that's down, weight bearing, and perform the exercise just like that. And if you want an even greater challenge, you'll throw it in the other arm, and this will offset your balance a little bit. So you really have to focus on going slow and making sure that knee stays over the ankle, just like, okay? Love that exercise. Another great glute med activator that I really like, and it's an excellent compound movement, is monster walks. And for this is a pretty strong band, so we're going to put it around the knees, and this is really going to force us to push our knees outward. And then for this exercise, all we're going to do is we're going to step side to side, and you can feel those glutes firing during this exercise, and you don't have to take very big steps. This is a great way to isolate the glutes in a compound movement. And then when you're ready to perform things such as resisted squats, just to ensure that we're really activating that glute medius, what you could do, I'll show you with a goblet squat, is have the band around your knees and just focus on getting as low as possible and really pushing out to activate those glutes. So those are many different ways that we can activate the glutes, all the way from a beginner to an advanced level. So I hope that you guys enjoyed this video and that you learned something. If you like this information, please like and subscribe for more health and wellness. Thank you.